think about that time that you were in the doctor's chair and the nurse took your vital signs and she told you that your heart rate is normal. Or that goal that you made, that you want to get in better shape, which means that you need to increase your heart rate to get in better shape. My name is Sarah Passy. I'm your fellow classmate and also a registered nurse, and I'm going to go over 3 things in this video. 1, how to check your carotid pulse and your radial pulse, how to count them, and also how to interpret the results. The first pulse we're going to check is the carotid pulse. It's the one in your neck. The carotid artery produces this pulse. You just touch your ear here, and with these 2 fingers, the third and the second finger, you're going to gently slide down about 2 inches. Once you locate the pulse, you're going to count for 60 seconds. This is going to give you the most accurate results. After 60 seconds, that is your heart rate. If you don't have quite that much time, you can count for 30 seconds and multiply by 2, or 15 seconds and multiply by 4. This is the best pulse to take when you are actively exercising. When I am actively exercising, it's hard to take your pulse for 15 seconds, so I will often just take it for 6 seconds and multiply by 10, and that gives me pretty accurate results. If my results are between 120 and 160, then I know that I am in a good, I have reached a good heart rate for, to increase my level of health and level of activity. The second pulse that we're going to check is the radial pulse. It's here on this side here. It comes from the radial artery. This is the pulse that you often check on somebody else. So it's about an inch down from the thumb. I'm just going to place the same 2 fingers, third and second fingers, on this side of the wrist here. Same thing, check it for a minute for the best accuracy. 15 seconds, multiply by 4 if you want a little quicker. Normal heart rate is 60 to 100. So once you've calculated your heart rate, if you're between 60 and 100, that is normal. If you're less than that and you're an avid runner or an avid exerciser, that is normal. If you're more than that, and you've gone to the doctor and you have a fever, a lot of times you will have an increased heart rate. Also, if you are dehydrated, you will have an increased heart rate. So I hope this was helpful. Today we learned how to check the carotid pulse, the radial pulse. We talked about counting it, and we also talked about different situations and ways to interpret it. Thank you so much. I hope this was